Now, beyond those with frank deficiency, there are micronutrient insufficiencies that are less severe, less clinically obvious, but much more prevalent. So 9% of American youth fall into the deficiency range for vitamin D, and 61% fall into the insufficiency range. So these common micronutrient insufficiencies reflect suboptimal micronutrient status that can entail some degree of compromise in physiological functioning, increasing the symptoms of many disorders through a variety of mechanisms. Bruce Ames has described inborn errors of metabolism, genetic polymorphisms that code for slightly structurally deformed enzymes that have reduced binding affinities for their micronutrient cofactors. And so the enzyme activity is reduced, leading to potential symptoms. Now, for these genetic disorders, increasing the dietary loading with cofactors can constitute effective treatment for these disorders. And Ames has described 50 different genetic disorders with these structurally distorted enzymes that can be countered simply with dietary micronutrients. Micronutrient deficiencies, he has shown, can increase oxidative damage to nuclear DNA and mitochondrial DNA, leading to metabolic changes in multiple organ systems, chronic inflammation, endothelial damage, neuronal deterioration, and accelerated aging. And he has shown in lab animals that these deteriorative processes can be slowed by providing dietary micronutrient-like substances. Ames has hypothesized that supplying a broad variety of micronutrients can be used to enhance and pervasively optimize physiological functioning, a process he calls a metabolic tune-up. So what this means is that for optimal physiological functioning, a full range of micronutrients is needed, not one, not three, not five. And that without a complete supply or complete enough supply of micronutrients, it should not be surprising that the health effects are abundant and diverse. There are many studies which Bonnie has reviewed showing that single micronutrients correlate with mood alterations in adults. And other studies that show that diet quality and food eating patterns similarly correlate with mental health in the expected direction, especially affecting mood. Micronutrients typically act together physiologically rather than as single actors. For example, the B complex. Many enzymes have multiple cofactors, so tweaking one doesn't necessarily have that much influence. And treating with a single micronutrient can often actually be disruptive by creating imbalances among the micronutrients and generating relative micronutrient insufficiencies. So a more scientifically and nutritionally sensible approach would be to examine the effects of multiple micronutrients acting in concert, with the notion that a broader range of micronutrients is more likely to provide pervasive physiological changes. So in the area of violent and antisocial misconduct, we have 4 randomized controlled trials showing marked effects on major misconduct and aggressivity. In these 4 trials, you can see, I'm not going to touch it, you can see have very strong effects, 25 to almost 50% reductions in violent behavior in prison populations, and one study in public schools, 25 to nearly 50% reduction in violence and major misconduct, just from giving micronutrients. In the area of ADD, we have one randomized controlled trial that you can see here in the middle. There are reasonable effect sizes both for treating hyperactivity and impulsivity, the behavioral component of ADD, and also for treating inattention, the cognitive component of ADD. We have no dedicated randomized controlled trials on mood disorders, but we have a post hoc analysis of this ADD trial in adults that Julia Rutledge had run. And what she did was she looked at the 21 adults in her sample with with ADD who also had moderate to severe depression. And the cutoff she used, a MADRS of 20 in the depression rating scale, is comparable to what's used in the FDA registration trials by the big pharmaceutical companies. So this is a reasonably rigorous and convincing level of population to be looking at. And what she found was a large antidepressant effect with an effect size of 0.64, one that compares quite favorably. It's at the upper end in general of what we see in antidepressant studies. So this is very significant, but it is a post hoc analysis. We really need this to be done in a sample recruited for mood disorders. In the open label studies on mood disorders, about 80% of drug-naive adults or kids with bipolar disorder improve both on mania and on depression. This is true for bipolar 1 and bipolar 2, and it's true for non-bipolar major depression. And most of these patients are able to completely discontinue their psychiatric drugs, totally, completely gone by forever. Again, in adults, we have many different studies. Meta-analysis of some of the best, of the highest quality studies found a small but significant improvement in immediate free call memory in adults in general, given broad spectrum micronutrients, normal adults. There was a study, a very large study of middle-aged adults treated for several years with broad spectrum micronutrients, and which demonstrated a slowing of age-related declines in executive functioning and verbal memory. In youth, the studies have generally found no consistent effect on individual components of cognition, but overall, nonetheless, a benefit for general academic functioning. Interestingly, again, with an effect size of 0.3. So looking at the various studies in normal populations, we generally get an effect size of 0.3 across a number of different areas. Now, effect size of 0.3 is a medical treatment we would not put a lot of credence in. That's a pretty weak effect. One might or might not do it. It would be quite ethical to do either one. But this effect in so-called normal populations is different. Here we're talking about what in effect is an easy and inexpensive life enhancement. So the same effect size of 0.3 could be viewed as valid and even valuable as an improvement in the quality of a normal life. The main findings that Bonnie was describing yesterday are studies that she and Julia Ruckledge have done following natural disasters like floods and earthquakes. And what they find is that broad spectrum micronutrients in the aftermath of a natural disaster has significant effects on acute stress and anxiety symptoms. And you can see here that the effect sizes for this effect are 0.7 to 1.1 or 1.3. So quite strong. That is really quite impressive. There's a reduction in probable PTSD in the population induced by broad spectrum micronutrients. At the start, 61% after micronutrients, 65% actually, and after micronutrients, 19%, whereas in the control population, there was no decrease at all. We have several different studies highlighting the notion that broad spectrum micronutrients can treat stress and anxiety. So overall, we have both in the areas of treating psychiatric symptoms and in the area of treating brain functions in normal populations, we have significant broad spectrum micronutrient effects. So unlike the single one-by-one micronutrient effects where we get little wispy effects that are not really particularly important, the broad spectrum micronutrient interventions appear to have more potential to modify brain function in more pervasive, potent, and diverse ways. It still involves a fair number of pills because you need to get fairly decent loading. So for the high quality broad spectrum micronutrient products, one would need something in the range of 8 to 12 pills a day, but you can march up with the dose very quickly over the course of a few days. But I do want to highlight that the time it takes for benefits to appear, if one is treating, for example, a drug-naive patient with bipolar disorder, one can actually see an effect on mania within a day or two of reaching the full dose. That is far faster than anything we have in psychiatry. You can actually get full remission within a week. None of our drugs come close to that. So the reason it's more complicated is that there are unexpected pharmacological properties of broad-spectrum micronutrients that I don't think anybody, certainly in psychiatry and as far as I know in medicine, would have really anticipated at the extent to which they appear. And these relate to interactions between micronutrients and drugs, and also, interestingly, between minerals and minerals. So I'm just going to list these, and this is not going to be sufficient for you to know how to manage nutrient-drug interactions, but just to give you an idea of why it's complicated and why you want to take some time to learn how to do this. So these kinds of interactions are quite potent and play a big role when you have the two drugs and micronutrients in combination. I mentioned there are also mineral-mineral interactions. Broad-spectrum micronutrients potentiate lithium by 100-fold, which is phenomenal. The 3 to 5-fold potentiation of most psychiatric drugs is enormous clinically. This 100 is totally mind-boggling, and we see it, frankly, every single time. So we wind up using microdoses of lithium in the range of 4 to 20 milligrams a day, instead of the standard 600 to 2,000 that we would use normally treating a bipolar patient. Some quick anecdotal observations on treating mood disorders with the broad-spectrum micronutrients. Overall, the antidepressant and anti-manic effects of the broad-spectrum micronutrients is completely comparable to what we can get with psychiatric drugs when the psychiatric drugs are working well. Basically comparable in efficacy, and of course with much fewer side effects. But there was something else that we did not expect at all, and that is that the completeness of the treatment is much greater with broad-spectrum micronutrients, and relapses are very few in comparison to what we get with conventional treatment. We have fewer residual symptoms, we have fewer minor fluctuations into minor symptoms, there are fewer adjustments in dosage. We rarely do even one dose adjustment a year. So the monthly medication checks that are standard in psychopharmacology, we don't need that. And we have hardly any hospitalizations. And interestingly, over time, the stability becomes even greater. For treating depression, S-adenosylmethionine can be used, again, at lower doses than normal. I prefer 5-hydroxytryptophan because it seems to be more effective in general. You know, that's the precursor to serotonin. But again, especially if you're using 5-HTP, as I prefer, in combination with carbidopa, with carbidopa, in the same way that you use carbidopa with L-dopa, you can use the same strategy to reduce the peripheral side effects of 5-HTP and enormously amplify the central effects of 5-HTP. Treating anxiety, I wish I had time to go into this in more detail, but let me just mention, if you don't know about inositol or theanine, you want to go learn about it. These are both anti-anxiety agents. I hardly ever use benzodiazepines in my practice, just don't need to. These work perfectly well. No dependency issues, no withdrawal issues, nothing complicated about it, no abuse issues. Inositol has both sedation and anti-anxiety properties, so it can be used for sleep induction at night as well as treating anxiety during the day. L-theanine is really interesting. That has only anti-anxiety properties without sedative properties. We don't have any other compounds that has that peculiar combination. It also has the peculiar property of countering some of the effects of caffeine. So if you drink too much coffee at dinner, you want theanine in your medicine cabinet at night. So a well-designed, well-balanced micronutrient product can really diminish micronutrient toxicity to the point that it really becomes relatively minor. So this is what we actually see looking across the various broad spectrum micronutrient products. Some products are better than others, but this is generally what one gets by way of sort of a relatively inclusive list of problems that come up. You can see that the adverse effects are pretty minor. The two that are worth highlighting are that the micronutrients can induce or aggravate candida infections. That can be occasionally a real problem. And if the dose of the micronutrients get too high, one can see anxiety, agitation, impulsivity in bipolar patients, mania, which can be treated fully, completely, quickly just by lowering the dose a little bit. So these are mainly nuisance side effects. They're really not a big deal. And compared to what we are used to in psychiatry by way of adverse drug effects, this is really minor. Issue of pregnancy is an interesting one. One could say, well, geez, what is the effect of giving all of these vitamins and minerals to a pregnant woman? What effect is that going to have on the fetus? Well, of course, we give micronutrients in broad spectrum to women, and it's great for the health of the infant. And in fact, there's some studies showing that women who receive broad spectrum micronutrients have a 50% reduction in birth defects, and that the reduction in neural tube defects goes down by 90%, far more than what folic acid alone will do. In terms of medical monitoring, I might highlight that there's also an interaction with antibiotics. The antibiotics, of course, will wipe out the gut flora, alter the microbiome, and the bacteria in the gut are essential for the synthesis of some vitamins and the absorption of the efficient absorption of vitamins and minerals. So if you have a patient who's on an antibiotic, you want to increase the dose of the broad spectrum micronutrients by a full 50% for the duration of the antibiotic treatment and for a few days after that. Some people ask about first-line use of these drugs, and I think that even in psychiatry, where we're dealing with some fairly significant presentations at times, to my mind, it's reasonable enough to use this unestablished treatment before established treatment if you can really say and document that there is no risk to delaying standard treatment. You need to document that, but then you can potentially use it. So we've seen that broad spectrum micronutrients can enhance a wide range of normal brain functions, reduce a wide variety of psychiatric symptoms, and increase the potency of most CNS active drugs in a variety of different ways. So how do we explain that? This is very different from what we normally see in psychiatry or medicine. Normally we think of something like lithium working in mood disorders on disease-specific mechanisms. In contrast, what we're seeing is that the broad spectrum micronutrients appear to operate through mechanisms involving an upregulation of CNS functioning that is not specific to any particular disease entity. For the micronutrients to potentiate drugs is still a bit of a puzzle. If you think pharmacologically, it doesn't really make a huge amount of sense that virtually all drugs. So one might ask the question, what is that about? Well, maybe the medications themselves are not being potentiated. Maybe the psychiatric patients are under-responding to their psychiatric drugs because their general biological functioning has not been optimized. And that by metabolically tuning up physiological efficiency with broad-spectrum micronutrients, one might appear to be improving the clinical response to psychiatric drugs and very possibly neuromedical drugs as well. So this is sort of an important hypothesis that needs further investigation, whether broad-spectrum micronutrients can be used to enhance the clinical effects of neuropsychiatric drugs, and I might say, for that matter, the kinds of interventions that you do as well. I want to highlight one animal study. If you take a rat and create a lesion in the frontal cortex on postnatal day 3, and then watch them grow into adulthood, there will be large permanent reductions in brain mass and functional capacity, as you would expect with a cortical lesion early in life. If you feed similar rats broad-spectrum micronutrients along with the regular diet, those rats will show more anatomic recovery along a number of different dimensions and more functional recovery. So here you see brains of adult rats. On the top, rats fed normal diet, and you can see this large gouge that persists into adulthood that even on the right side is obvious just with gross inspection. Given the micronutrients on the bottom, look at that change. Now the tissue, of course, isn't normal. But again, on the lower right side, that is a very surprising degree of gross anatomical recovery. I've mentioned some anti-aging findings that Bruce Ames has showed that micronutrients can slow age-related deterioration in multiple organ systems. And I mentioned the findings that broad-spectrum micronutrients can slow age-related declines in executive functioning and in verbal memory in humans. There's also a cross-sectional study, a correlational study in humans, finding that regular daily multivitamin users have 5% longer telomeres. It's a correlational study, not so hard, but still several lines of evidence pointing in the direction of anti-aging effects of broad-spectrum micronutrients. Interestingly, these findings are mainly seen with nutrient interventions involving 3 or fewer ingredients. And the findings become much more favorable with formulations containing more than 10 micronutrients. So the desirable characteristics of a good broad-spectrum micronutrient formulation would be at least 10, and preferably more in the range of 25 or more micronutrients. Dosing that does go above RDA levels in certain cases, but generally below tolerable limits, but you're mainly looking for a well-balanced formula with proper ratios among the ingredients to avoid imbalances. You want a product with high bioavailability, so that rules out anything you can buy in a drugstore. You want high quality control, obviously. You would like to have the product not contain substances that will inhibit drug metabolizing enzymes. And you would like compounds that actually have research done on them, or essentially the same formula. And in general, you want a product that's going to cost around $4 or $5 a day. You might want it to be less, but this is what they run to be able to develop these very high quality micronutrients. So our hopes for the future development of this field include the development of a low-risk, low-stigma, health-promoting treatment for violence in prisons and conduct disorder in schools, a non-abusable treatment for ADD that is more likely to enhance growth than diminish it, a treatment for mood disorders with fewer side effects and greater long-term stability than current standard of care approaches, the enhancement of stress tolerance, cognitive performance, and sense of well-being in healthy individuals, and that this may be a gateway to being able to enhance neurodevelopment, delay neurosenescence, and perhaps slow down neurodegeneration. So obviously, we need more safety and efficacy research. So this is a pitch to pay attention to micronutrient biology.